Hi, my name is Parthav Kartik and I'm going to be presenting about primary amoebic meningoencephalitis. I'm a sophomore at Biotechnology High School and my research topic is the epidemiology of primary amoebic meningoencephalitis, also known as PAM. This topic is close to my heart because my grandfather was affected with bacterial meningitis, which has similar initial symptoms to PAM. PAM is rare but deadly, and an infectious disease that impacts the central nervous system. My research questions are: how does a free-living amoeba, Naegleria fowleri, cause central nervous system infections, leading to fatalities? How does primary amoebic meningoencephalitis avoid the immune system? And how can we improve the survival rates of PAM? And can induced pluripotent stem cells, or iPSCs, be used to treat PAM? An overview of PAM is that Naegleria fowleri, also known as the brain-eating amoeba, thrives in soil and warm freshwater lakes, affecting people who normally jump into lakes, and enters the body through the nose. The symptoms progress. The amoeba progresses rapidly within 1 to 8 days, and symptoms occur around a week to 2 weeks in. Some symptoms include fever, severe headache, nausea, vomiting, and more. The diagnosis is through contrast-enhanced CT scan and magnetic resonance to detect cerebral edema, and a scan of the CSF through lumbar puncture. There is some medicine for treatment, but it only works during the early stages of the infection. But it's hard to find the infection in the early stages. So the literature review is that currently, globally, there's only 381 confirmed cases, and only less than 2% are survivors. Behind the US, Pakistan is the second most Naegleria fowleri infections, with 146 between 2008 and November 2019. Some shortcomings of the disease for studying it is that it has a high mortality rate and can be fatal in less than 2 weeks after initial exposure. Because the infection is rare and progresses rapidly, it's hard to treat the patient, but because of the limitations. N. fowleri has developed strategies to dodge the immune system, making it difficult to treat using the protein complement receptors in neutrophils, a part of the immune system. It is possible to use iPSCs, or induced pluripotent stem cells, to treat Naegleria fowleri and use it to disable those protein complement receptors in the amoeba. My research is only a literature review and doesn't have any lab work. I used case reports in science libraries and journals like the EID journal. I reviewed articles from the CDC, NIH, NCBI, and the American Journal of Tropical Medicine and Hygiene. Through these articles, I was able to gather subjective experiences and clinical observations related to the causes of PAM, the medical significance of Naegleria fowleri, and the possible treatments using stem cells. It's very important that the disease is diagnosed early, and if it isn't, then the patient survival is at a very low chance. Using stem cells, we can dive deeper into disabling the protein complement receptors, allowing the amoeba to be recognized by the host immune system. My conclusion is that Primary meningitis, or PAM, is a rare and deadly CNS infection with a high mortality rate. It progresses rapidly, thereby reducing the diagnosis and treatment window. There's a need to develop greater awareness so that individuals can approach the medical facilities for early diagnosis. And although stem cells are not currently used as direct treatment for PAM, we hope to develop high throughput screening assays for new drugs against N. fowleri in the near future. We can use stem cells to understand the host's immune response to N. fowleri to pave pathways to developing vaccines or immunotherapies in the near future. I'm very grateful to Gifted Gabber for my research experience, and especially to the Gifted Gabber team and Coach Joe. They allowed me to connect with very good college professors while I'm still in high school. I'd like to thank Dr. K personally for her expertise in infectious diseases and sessions where she explained the history and origin of infectious diseases across the world. I'm also very grateful to Professor Virgil, who taught us about the ethics of writing research papers and the format of it. He also helped with the title and the APA format. Last but not least, I want to sincerely thank the back-end research team for organizing the program and providing this platform to me. Thank you.
Professor Kate, questions for Parthav? Yeah.
Yeah. We worked together a few different times, and it was really nice to do that kind of stuff one-on-one. This is a question for you. If I tomorrow, and gosh willing it doesn't happen, if I should pick up this amoeba, the one that you were speaking of in your talk, what are my chances of survival without some new developments that you talked about?
It's basically 100%. Like almost all patients that had it died.
Yeah, we died. Yes. So I'm hoping really hard I don't come into contact with it. I don't plan to. Where is this usually found?
It's usually found in the southern parts of America and in America at least, but there's hardly any cases at all in the world.
Right. Very good. Thank you so much.
Thank you.
You did a nice job. You're welcome.